Hello, everyone. My name's Veronica Daub, the manager and editor of Eyecare Business magazine. We're here with Dr. Ryan Parker, who is the Senior Director of Professional Affairs with EssilorLuxottica, to talk about Stellest lenses. For years, myopia management often focused on correcting vision. How is the standard of care evolving, and why is it important to think beyond simple correction?
Yeah, it's actually a really exciting time for us in the eye care profession. It's not very often that you can be in the middle of an evolution of the standard of care. So there's a lot of different associations out there that have kind of changed their tune around myopia management. So I view myopia management as a chronic progressive condition. Depending on the day, sometimes I would even call it a chronic progressive disease, but some people that's a little bit too much for. So let's just say a chronic progressive condition. For years, we have treated just one symptom of that, and that is blurry vision with kind of standard correction with glasses and contact lenses. But now, as we're learning more and more about the progression, the risk factors, we kind of need to rethink how we have the conversations with patients around myopia management, myopia control. Of course, we still have to focus on delivering good vision, but the science has shown us there's a whole lot more to it now. So having conversations around myopia management with certain myopia control solutions is kind of slowly starting to become, I don't want to say a new standard of care yet, but we're getting really close to that.
Yeah, it's top of mind for everybody these days. What are some of the long-term risks associated with progressive myopia, and how can early intervention help improve patient outcomes?
Yeah, it's funny you said top of mind, Veronica, and I love that because if you would have told me in optometry school that I would be talking about myopia every single day of my career, now I'm going to age myself, graduated from optometry school in 2004, but now, over the last 5 to 10 years, it has been like at every CE meeting that we've gone to, there's always a myopia management track. So your question is right on cue. Why? Why does it matter? Well, there's a couple things with myopia progression. Number one, I know this is simple, but it's the number, it's the prescription. A lot of parents that we talk to, I've never met a mom or dad yet that goes, yeah, I'm a -8. I want my kid to do more. I want them to be a -10. So they're always worried about that number and reducing the number of prescription. Obviously, when they get to adulthood and they're uncorrected, having that high level of myopia creates some visual impairment. But in addition to that, there is a risk for retinal conditions, myopic macular degeneration, retinal detachment, cataract, and glaucoma all have an increased risk specifically as the prescription goes up. So the more correction you have, the more your risk factors for those conditions greatly increases. And what we're learning is the sooner that we can intervene, because remember, kids, the younger they are, they progress, they grow quicker. So if we can lean in earlier, we can greatly reduce the risk factors for those conditions. In fact, one of my good friends, Dr. Mark Bullimore, had a study published that says every diopter matters. Slowing down myopia progression by 1 diopter, just 1 diopter, has the potential to reduce the risk of myopic maculopathy by 40%, retinal detachment by 23%, glaucoma by 16%. And so intervening early and really leaning in with those conversations can have a profound effect on these kids' future.
Yeah, it really sounds like getting the conversation started early is really key. So, on a whole, Stellest lenses are changing the myopia landscape. How is that happening, and how will wearers benefit from the technology?
Well, I think it's really exciting for our US-based practitioners to have another tool in their toolbox. There's one other FDA-approved solution out there called MySight from Cooper Vision, really great product. Stellest is FDA authorized, and so we have two things that I like to say are blessed. Now, as a lot of your viewers know, there's a lot of off-label things, and don't want to go down that rabbit hole today. But what Stellest has done is it's kind of removed some of the barriers. Some of the barriers with fitting children in contact lenses, prescription ranges, the amount of astigmatism that Stellest corrects. It's really, like I said, eliminated the barriers. So it's opened up this myopia management conversation to a lot of practitioners that historically have been like, you know what, I don't want to quite get into that yet because it's kind of a heavy lift. Fitting some of these other solutions requires a little bit more expertise. But now with Stellest, it is a pair of glasses that has amazing technology that slows myopia progression in children. And so we see, even though our inclusion criteria is 6 to 12 years of age, practitioners that prescribe off-label are finding it very simple to use on young children, and then like those prescriptions that may not have fit some of the other norms. But quite frankly, sometimes mom and dad go, I don't want to put my kid in a contact lens. I want to put him in a pair of glasses. So this just finally creates, and it kind of rounds out the toolbox for myopia management practitioners.
Yeah, it's an incredible thing to have as an extra offering because
Yeah.
contact lenses could be a little daunting for a kid for sure. How do you suggest starting this conversation with parents or guardians? And what are some of the best practices to educate them on myopia management?
Well, learn from everything that I did wrong when I started this in my career, because I overcomplicated it. Sometimes I spent like 15 or 20 minutes trying to just almost scare parents into myopia management. I found out it's really simple. So keeping it simple. One of the things I like to do is actually use, when I'm talking to mom and dad, is use the word nearsightedness, not myopia. They don't really understand the difference. And if you switch back and forth, it gets confusing. So just saying, hey, your child's nearsighted. We now know a whole lot more about it. As they grow, their prescription will increase, their eye will increase, and that can create some risk factors later in life. There's a lot of tie-in to the fact that the visual environment is changing, and the reason we have so many myopes now is the fact that we are connected, we're closer, we're not going outdoors as much, and that's why we're starting to see like half of the world's population will be myopic by 2050. But then I say, hey, there's good news. We have solutions that are clinically validated to slow myopia progression in children. So I really like to lean into the prescription because, like I said, parents want to make sure that we can reduce that correction. Also, sometimes mom and dad will sit there and go, okay, I hear you, but I'm going to get them LASIK when they get to be 18. And I really like that because then I'm like, okay, that's great. Because if we do myopia control, myopia management, we're going to decrease the prescription and increase the success rate of LASIK later in life. Because as I talk to my friends that are LASIK surgeons, I've never met one that goes, I would rather do surgery on a -8 compared to a -4. So they're big proponents of myopia control as well. So I think keeping it simple, not really necessarily focusing on doomsday, leading with the here and now, being able to reduce the prescription, being able to slow eye growth down, being able to relieve some of the fear of them working on digital devices for so long, I think seems to resonate pretty well with mom and dad.
That's great. Such great intel here. And thank you so much for taking the time to talk about this with us. Where
Always my
can eye
pleasure.
care, awesome. Where can eye care professionals learn more?
Yeah, so this one's pretty simple. Just get on your favorite device and go to essilor.com. You'll see at that page right at the top, there's a huge banner of Stellus. You can click there, go to learn more. Obviously, right now at Essilor Luxottica, this is a priority for us, and so we have a lot of information there. Also, hey, if your viewers are out in market and at all the different events that are coming up, most likely myself or someone from my team in professional affairs will be out there doing some peer-to-peer education. So go to essilor.com and then look for some live educational events that may be coming to a city near you.
Thank you so much. And stay tuned with eyecare business for all things myopia management and all the updates coming through with Stellus lenses.